6 Do's and Don'ts of Aftercare Planning. For professionals partnering with families affected by substance use. Do help families understand that a substance use disorder is a long-term condition that requires ongoing management using a chronic care model. Professionals in the dependency system often set the stage for families' understanding of and expectation of treatment and recovery. When treated as a typical acute condition, families may anticipate a single brief episode of treatment, culminating in lasting, self-sustained sobriety without the need for continuing care or long-term management of the disorder. This can lead to shame, stigma, and isolation when sustained remission is not achieved. Contrast that with other chronic disorders, such as asthma, diabetes, or autoimmune conditions. Quality treatment for these conditions involves phases of care, including symptom stabilization, acute professional-guided treatment episodes, and long-term client-directed management of symptoms. Patients with these conditions do not expect a cure, but work towards enhanced functioning, reduced severity and frequency of symptoms, and empowered self-management of the disorder. Family treatment courts and other child welfare interventions are acute, time-limited interventions in a family's life. Because of this, it is easy for professionals and families to see the end of FTC or a child welfare case as the finish line or a resolution of their SUD and other related concerns. Research paints a different picture. Studies show that within a year following treatment discharge, 40 to 60% of clients return to active substance use. A 2016 meta-analysis showed that between 35 to 55% of individuals with SUD achieved remission after an average follow-up period of 17 years. However, there is plenty to be hopeful about. Of the 27.5 million Americans who report ever having an SUD, 75% report being in recovery. These statistics paint the picture of substance use disorder as a chronic yet manageable condition. When teams shift to a chronic care or recovery management model, the FTC can be the foundation of a successful recovery journey. Supported by multidisciplinary professionals, parents can use their time in FTC to initiate abstinence, achieve symptom remission, connect with recovery support, and begin managing their disorder. Don't downplay the importance of continuing care for sustained recovery. Individuals who adhere fully to their continuing care plan through 12 months post-treatment discharge are significantly more likely to experience continuous abstinence and report a positive quality of life. Other gains include decreased emergency room visits, reduced criminal recidivism, and increased family stability, employment, stable housing, and overall well-being. Continuing care interventions are most effective when they include longer planned durations of at least 12 months, especially for those with more severe symptoms. Education, engagement, and commitment to a continuing care plan before treatment discharge. Active efforts to engage and retain participants through the continuing care period. Regular and ongoing monitoring of the individual's symptoms, status, and functioning. Formal and natural supports. What does this mean for FTCs? Teams can begin educating parents in early phases about the importance and expectation of continuing care. Families should understand the difference between brief symptom stabilization and evidence of sustained recovery. Long before FTC commencement or case closure, treatment providers can help parents set realistic aftercare goals, consisting of both formal FTC and treatment supports, and natural, community-based supports. FTCs can require parents to attend a continuing care orientation prior to discharge, including an initial post-discharge appointment scheduled within 7 days of discharge. Some FTCs have also moved away from holding a graduation celebration and instead host a ceremony that honors the family's transition out of the FTC and into their next phase of recovery. Do support the creation of individualized, inclusive, coordinated, and realistic aftercare plans. Plans should be individualized to the parents' and family's needs, goals, and lifestyle. Inclusive of all recovery needs, including substance use, mental and physical health, medication, employment, education, housing, and community building. Coordinated with other remaining treatment plans or requirements. Realistic of what a parent and family are capable of, interested in, and willing to engage in. And bolstered by both formal and natural support systems. In the last phases of FTC, parents are given the opportunity to demonstrate their ability to maintain a pro-social and stable lifestyle, prioritize recovery, and recognize and respond to their children's needs. Continuing care plans should be established before this time to give parents the opportunity to try out the activities, structure, and supports while still in FTC, signaling that the plan is realistic to the family's needs and schedule. Don't forget about the family. Substance use disorders affect the entire family, and recovery is a family journey. However, the inclusion of family members in aftercare planning is often lacking or completely absent. When supporting the development of a parent's aftercare plan, teams must keep the family at the center. This means a specific focus on the individual's role as a parent. Identify services or supports to foster the person's recovery journey as a parent. Consider parent-specific recovery support groups. Parent education tailored to their child's age group and natural community-based connections where parents meet, such as schools, churches, libraries, and sports teams. The child's recovery. Just as the parent's recovery journey does not end at case closure, neither does the child's. Teams can prepare children prior to case closure for what life may look like, including the parent's appointments and meetings, shifting family dynamics, and the child's own services and supports. Children can help create their own plan, including names of safe adults to ask for help, and lists of situations that may require them to seek that help. FTCs can also educate families about adolescent substance use prevention, including available evidence-based programs. Other family and kin. Whether they took an active role during the case, family and kin may be involved with the family after case closure. Family members can be educated about SUD, return to use, recovery, and the importance of aftercare and adherence to aftercare plans. Family members can encourage healthy behaviors and habits and consider participating in couples or family therapy. Safe family members can also be prepared to support parents through a return to use, ensuring the safety of the children. Do get creative about how to support parents after case closure. Overall, research shows that continuing care is most effective when it's available for an extended period of at least 12 months, and individuals are actively engaged throughout that period by trained peers or professionals. FTCs and treatment providers can utilize the following approaches in addition to more traditional 12-step recovery support and mutual aid involvement. Aftercare tracks. A voluntary or mandatory phase available to families after FTC or case closure to provide continued support, aftercare plan monitoring, and treatment re-engagement as needed. Alumni groups. Groups offering structured activities, peer connections, ongoing support, and continued links with the FTC after commencement or case closure. Many treatment courts connect participants with alumni groups in the months prior to case closure to give them an opportunity to build relationships. Recovery management checkups. A long-term clinical approach similar to the management of other chronic illnesses with the goal of detecting a return to use quickly, leading to prompt treatment re-entry. Recovery management checkups include quarterly clinical assessments, urine testing, and service linkage when indicated. Telephone-based continuing care. Ongoing and titrated telephone-based monitoring and brief counseling focused on symptom severity, functioning, progress on goals, and coping skills practice. Mobile health technology. Apps that offer monitoring of symptoms and mood, coping strategies, emergency support resources, or self-testing options. Don't leave parents without a way to reconnect with treatment if needed. Asking for help after a successful case closure can be a daunting step for parents, and teams must remove any barriers possible that may hinder parents from seeking re-entry to care. By normalizing this process and maintaining an ongoing connection between the parent and treatment provider or case manager, parents can reduce the time to treatment re-entry and reintervention, leading to better long-term outcomes. Thank you for watching. Training and technical assistance is available at any time. You can reach us at ftc@cffutures.org. See you next time.